Obesity and weight concerns are diagnosed here. This is Ground Zero, the primary care provider's office. And according to the Missouri Department of Health and Senior Services, almost 2 out of every 3 adults in Missouri are overweight or obese.
We're really excited about the Weight Loss Project. It's a $3 million contract award that enables us to offer our patients even more innovation in the area of weight loss management.
At Mercy, JoAnne Levy is Vice President of Mercy Research. Levy explains how primary care providers in the Mercy Health system are preparing to become priority in 2025 for an all-new system and strategy for weight loss. After all, the primary care provider is the first point of contact for most people.
Get the right care to the right patient at the right time at the right place.
Mercy receives a $3 million funding award from the PCORI organization.
PCORI stands for the Patient-Centered Outcomes Research Institute, PCORI. And it is a not-for-profit, independent organization that funds comparative clinical effectiveness research across the country.
Traditionally, PCORI funds research, but in this case, it's for the new Mercy Intensive Lifestyle Treatment for Weight Loss program. And this time, the PCORI funding is different. PCORI set up a program called the Health Systems Implementation Initiative, or HSII.
So the reason they did that was very interesting. Once you start research, it takes on average about 17 years for that research to actually translate into a change in clinical practice. So when you think about that gap, the time that it takes, the patients that are missed during those 17 years, when we know something could be better, to the time we actually change the practice. They decided that they were going to set up the HSII program to address that time lag. So the whole purpose of the program is implementation. It's not research. It's to take research conclusions that exist and translating it into clinical practice. So it's really focused on research implementation.
So Mercy is now one of 42 health systems across the entire country selected to participate in cutting-edge clinical programs that HSII offers. But first,
up to $500,000 of funding to get ready to build capacity to address implementation. We also estimate that there's about 1,500 Mercy coworkers who would be involved in helping implement the program.
And the one program Mercy chose addresses one of the biggest health problems in Missouri.
Obesity is a 35% incidence across the country, and it's even higher in the 4 states in which Mercy operates. Just in the St. Louis area alone, statistics show that 1 in 3 adults has an obesity challenge.
As adult obesity rates have risen, so have the related conditions of diabetes, heart disease, and premature death. And primary care providers are the first line of defense. Coming soon, the new program will target obesity at all 237 primary care clinics across Missouri, Kansas, Oklahoma, and Arkansas.
And ultimately, we ended up being one of only 6 healthcare systems across the entire country that was awarded funding.
The new Mercy Intensive Lifestyle Treatment for Weight Loss program will roll out to patients in November of 2025.
For those patients who meet the criteria, the program consists of lifestyle coaching, in-person and virtual. It consists of text messaging reminders, something that we're very good at. It has a virtual care component, something that Mercy is nationally, internationally known for. And it also has an entire set of educational materials and metrics that we will be monitoring to ensure that our patients achieve the same kind of success that was shown in the research study and its conclusions.